Hello everyone, my name is Dr. Bajwa and I'm one of the dermatologists working at the Royal Victoria Infirmary in Newcastle upon Tyne. I'm delighted to have the opportunity to discuss a medication which has been offered to you called Dupilumab. Dupilumab is a medication which is recommended for those patients, such as yourselves, who have moderate to severe atopic eczema and is licensed for adults and children over the age of 6 who have not improved with other treatments. These treatments may have included cyclosporin or methotrexate. It is also offered for those who are unable to take other treatments. There are alternatives to Dupilumab, which are best discussed with your dermatologist. Dupilumab is a medication that has been available since 2019 and is very successful in controlling eczema. It's a drug known as a biologic medication, which is specifically made to treat atopic eczema. It works by blocking specific chemical messengers known as cytokines, and by blocking these, it controls the inflammation in the body and helps ease the symptoms of atopic eczema. What we do know about Dupilumab is that it does not suppress your immune system, and therefore it is safe to take with other illnesses such as cancer and is generally well tolerated. From the data that we do have, we also know that it is safe to take if you were to get an infection. Dupilumab is known to cause some side effects, and around 1 in 3 people will develop dry and itchy eyes, as well as the possibility of conjunctivitis, which may present as red, sticky eyes. Your dermatologist may provide treatment to prevent this, known as prophylactic eye care. This may include a lubricating eye drop, an antihistamine, and a mild steroid ointment for your eyelids. Other measures you may be able to undertake include keeping good eye hygiene, as well as keeping your eczema well controlled, especially on your face. Less than 1 in 20 people stop this medication due to these eye side effects. Other less common side effects which you need to be aware of include developing cold sores, which affect 1 in 10 people, as well as joint pains, and some people may develop a mild reaction at the injection site, which may present as redness or swelling. Severe allergic reactions are very rare with Dupilumab. Prior to starting Dupilumab, you will need to have some blood tests. These will check for previous infections, including chickenpox. However, thereafter, you will only need to have blood tests done once a year. It's important to remain up to date with your vaccines. However, it is not safe to take live vaccines whilst on Dupilumab, such as the chickenpox or shingles vaccine, rubella, yellow fever, and some polio vaccines. Non-live or inactivated vaccines are safe to take. Dupilumab is given as a subcutaneous injection, which may be given as a pre-filled syringe or a pen. A healthcare professional will teach you how to inject this. For those over the age of 12, Dupilumab is given every 2 weeks and can be used long-term. For those who are aged between 6 and 11, we would recommend you speak with your dermatologist as the frequency of the injections differs. Although Dupilumab is not licensed in pregnancy, we do know it is safe to take in the 1st and 2nd trimester. And if you are planning or are pregnant, please discuss this with your dermatologist. If you do miss a dose of your Dupilumab, it is important to take the dose as soon as possible and speak with your dermatologist. Dupilumab needs to be stored away from light and in a refrigerator between 2 and 8 degrees, and once removed from the refrigerator, should not be put back in and used within 14 days. If you are considering traveling abroad, please discuss this with your dermatologist, as further precautions may need to be taken from infections such as parasitic worms. Topical treatments and steroids are safe to use. I hope this video answers some of your questions, but if you have any additional queries, please do not hesitate to get in touch with your dermatologist.